Talk. This is hosted by the College of Arts, Sciences, and Education, the Trinity University of Asia. This Trinity Talk is entitled COVID-19 Pandemic, The Real Score, and How We Will Be Back to Normal. So I'm Lito Argayosa, the current department head of the Biology Department of the College of Arts and Sciences. So we focus on the microbiology as in our curriculum. And with that, this is very much in tune with the current issues on the COVID pandemic. As I speak, there's about 40,336 cases recorded in the Philippines today, and 1,280 has died have died of the pandemic of the COVID-19. And so, with that, it is my pleasure to introduce to you our guest panelists today, beginning with Miss Karen Viola. She's actually an alumna of the St. Luke's College of Nursing and currently works. Hello, Miss Carcy.
Hello, Sir
Eh,
Lito. Thank you very much. And
yeah,
hello to my fellow panelists
yes.
here in the Philippines and of course here in Europe kung gising
Yes.
sila. Thank
Yeah.
you and good morning. And I hope we'll have a very, exciting discussion and I hope at the end we'll learn a lot.
Yeah. So she currently works. Thank you, Mom Carsi. So she currently works at the University Clinic in Freiburg, Germany. And
Yes.
so guten Morgen, Frau Carsi.
Guten
So she'll
Morgen.
yes. So she'll be answering questions related to healthcare issues um, and the issues of the frontliners, no healthcare frontliners. So thank you very much for joining us today,
Thank
Mom
you very
Carsi.
much.
Okay, so our next panelist is also a graduate of the St. Luke's College of Nursing, and he studied Masters in Public Health at the UP Manila and pursued his PhD in Communication Science at Nanyang Technological University. He's now a Bullard Research Fellow at the School of Information at the University of Texas, Austin. No? And he has publications in Journal of Health Communications, Journal of Medical Informatics Association, and his research interests include consumer technologies and the use of smartphones in healthcare, especially in clinical settings and in non-healthcare contexts. So he is also he also works on infodemiology and e-health on COVID-19. He's no other than Dr. John Robert Bautista. Sir John?
Ay, good morning po. I hope safe and well po yung ating mga viewers ngayon. At I'm looking forward for a fruitful discussion with my co-panelists. Again po, magandang umaga po sa lahat.
Magandang umaga po. So he will try to answer our questions on COVID-related questions on information or disinformation, mga fake news that's going around also. So our third panelist is a physician scientist and works specifically on vaccine related researches, right? So he's a
Yes.
vaccinologist. He's a medical director at Takeda, a digital health expert for World Health Organization, and has been a TED educator. So we are indeed interested to hear more about his insights on this race on vaccine development in the world and what we need, to be able to go back to normal using these vaccines in the future. So let's get started. And so Dr. Melvin Sanikas, welcome. And thank you for
Thank
joining
you,
us this
Sir
morning.
Lito. Thank you. And magandang umaga po sa inyong lahat.
Okay. So thank you very much. So let's get started, no? Let's throw in the first question. The first question is for everybody. And the question is, in your opinion, where are we and how are we doing in relation to the COVID-19 pandemic? So siguro Dr. Melvin will can start the ball rolling.
Okay, so where are we in the pandemic? Definitely, we are not yet in the peak of the pandemic. If you look at the number of cases in other parts of the world, for example, in the US, Brazil, India, Russia, the cases are really going up.
Mm.
Um, cases are increasing basically globally. Um, there are countries that have controlled the outbreak in their local situation, pero as a whole, we are still in a situation where we need to do as much as we can in terms of public health measures to make sure that this does not worsen.
Okay, so which means that the cases are still rising in most
Yes.
places, right?
So
And
for perspective, Sir Kunyari, for the first million, it took 100 days for
uh-huh.
us to reach from 0 to 1 million.
Mhm.
Pero succeeding millions until we reach 11 million cases na now,
Mhm.
6 days, 8 days for us to reach the next million. So talagang nag-increase ang cases at yes.
Okay, so let me ask the same question and to Miss Carcy.
Sir
So
Lito, I think
yeah,
I
what's the
really
real
think that
score?
we're still on the peak of the pandemic. In terms of Philippines, I think they're on the parang starting line pa rin to say because like for example here in Germany they they have overcome the peak of it, and now they're like starting to go back to what's to the new normal. But for the Philippines, we're still struggling. We still have cases, high cases, deaths and recoveries are deaths are getting lower and recoveries are somehow improving, but we're still on the struggle phase, and we shouldn't be like complacent with the situation because yun nga, we're still there. That's what I
Yeah,
think.
yeah. I want to pick up that word that you mentioned, Miss Carcy. On being non-complacent, right? So we should be non-complacent and cautious right now to be safe,
Mhm.
right? Yeah.
Yes.
All right. What about Sir Robert?
Ayan. Good morning po sa lahat. Yung situation po is, to give context po, nandito po ako sa Amerika po, particularly sa Texas. Sa iba't iba pong estado ng Amerika po, iba po ang kanilang pattern. For now, the worst cases are here in Texas, in California, and in Arizona, and to some extent pati Florida. So
Mm,
as compared to New York is particularly New York and Washington, hindi yung Washington DC, yung Washington State, which is
mm,
part siya ng Seattle. Sila yung
mm,
isa sa mga naunang nagkaroon ng COVID-19 cases, and somewhat they were preventing the collapse of the healthcare system. So they were already somewhat going down. But
mm,
on other states, it's about going up. So just like Texas, Arizona,
mm,
California,
mm,
and Florida. So in the case ng Philippines, there have been debates na we already flattened the curve, but personally, we can only say na we can flatten the curve if our reproduction number, yung tinatawag nilang R value,
correct.
if
Yeah.
less than 1,
Mm-hmm.
based do sa study ng UP Diliman,
Mm-hmm.
our reproduction number sa buong bansa sa Pilipinas ay 1.2 and
Uh-huh.
1.19 sa NCR, at ang may pinakamataas sa ngayon is 1.96. So
Mm-hmm.
most of the cases would actually start sa mga major cities like
Mm-hmm.
NCR, then susunod Cebu.
Mm-hmm.
Then it would eventually spread sa iba't
Mm-hmm.
ibang panig ng Pilipinas if we don't actually take public health measures. And we also have evidence na that it's spreading to some of the rural areas because of
Mm-hmm.
some of the local migration patterns that we have. So
Mm-hmm.
that is somewhat of a concern. And to
Mm-hmm.
point out, tayo may second highest deaths and active cases sa ASEAN. And
Oh.
tayo may lowest percentage ng recovery. So it
Uh-huh.
speaks volume nung reflection ng public healthcare system sa
Mm-hmm.
Pilipinas.
Mm-hmm. Mm-hmm.
I think we were not much affected by SARS. So we don't have much memory of what happened to SARS as compared to other countries that they were able to improve their healthcare system during
Mm-hmm.
the SARS period.
Mm-hmm.
Philippines, parang ito yung pinaka-major pandemic na kinakaharap natin sa ngayon.
I see.
At least on the
So
memory of the people.
So looking at the graph presented by the DOH, right? The death rate seemed to go down, right?
Hmm.
So, but looking at the overall scenario, it's still increasing. So,
Yes.
what about the doubling rate of these? Previously, it was 6 days, right? 5 to 6 days. Now, is it slower or faster in terms of the doubling? If we will predict, like say next week, if it's gonna be that number of days for the doubling time, how many will be expected to be infected, and how many would die?
I think yung sa doubling time, it's one metric to actually look at. That's one of the acute ways to actually look at this increase of spread. But
Right.
yung sa atin kasi mas nagpo-focus na tayo, even for most reports sa buong mundo,
Mm-hmm.
they don't really focus on the doubling time. Yung doubling time yun yung mahalaga kapag yun nasa
Mm-hmm.
acute stages tayo nung pandemic, which is hindi natin alam kung anong nangyayari. Pero since we hope that we are on the recovery, yung
Mm-hmm.
mitigation phase, we're actually looking at the total number of cases. So, just for example, sa New Zealand, they actually almost eradication na sila. Eradication means not necessarily zero, but it's to
Yeah,
the point na their reproduction numbers are actually below one and they are somewhat able to slowly open up their economy.
I
So
see.
what we actually need is to actually lower the number of cases despite having more testing that that's happening. Mahalaga rin
Yeah,
kasi na marami tayong matest so that we can actually isolate, trace, and contain those who are infected.
I see. I see. Yeah. Well, in my opinion, because I think New Zealand has fewer population, right? So
Mm.
I think the social distancing is realized much better in New
Yeah.
Zealand, right, compared to other
Kasi,
countries like the Philippines.
yeah.
Actually, Sir Lito, I
Yeah.
agree on that.
Thank
Eh.
you.
I agree on that, Sir Lito, because I have this realization now why is parang in the Philippines, it's so hard to keep distance. It's so hard to practice and hygiene or practice, just it's so hard to be safe,
Mm-hmm.
to be in simple terms. But here in Germany, we are actually already on the we say from the Philippines GCQ or NECQ. We can
Mm-hmm.
already go out to we can eat in the restaurants. We
Mm-hmm.
can go to the park.
Mm-hmm.
And I guess Philippines can also do that, but for now it's not possible because the population of the Philippines is really high. And I think that's really what's stopping us or what's holding the Philippines from being really able to do this GCQ very effectively because of the population of the Philippines, not only on the especially on the poor sector of the country na sobrang
Mm-hmm.
crowded talaga na ang hirap din magstay safe.
Physical, yeah, to require them for physical distancing, right? But right now, for your information, the malls have opened already.
Yeah,
And yes, so the malls and some restaurants have opened already. So it seems to be much more relaxed right now. And several weeks ago, the number of cases have spiked also because of that. So the government has delayed a bit the modified ECQ for Metro Manila. So, but yes, we're starting to go out and we're starting to work actually here in Metro Manila. And I
yeah,
think because of the economic burden that's produced by this COVID-19, that's why the government decided to open up and ease a bit in terms of quarantine and ECQ. So, okay, so thank you very much for that. And let's have a question for Dr. Melvin Sanikas on vaccine. All right. So, do you think a vaccine would really help, right? And is it possible to receive that or to get that in the near future? When we say near future, what would be the actual uh, number of months that we're expecting for this vaccine to come out for
Okay.
the Filipinos and
So,
for the world? Yeah.
for your question, if it's possible, yeah. So there's a higher
Yeah.
chances for us to have a vaccine. Um, a group of researchers and at MIT actually looked at all the drugs and vaccines that were approved and the clinical trials for those drugs from 2000 to 2015. And nakita po nila that the the success rate of drugs and vaccines in general is around 13%. So it's a bit on the low side, right? But it depends on the therapeutic area. So cancer drugs, medyo mababa talaga ang success rates, around 3%. But for vaccines
I see.
in infectious diseases, it's quite high actually, 33%. So if at the moment we already have at least 20 vaccine candidates in the clinical trials, and if we apply that 30 to 33%, so we could expect at least 6 vaccines to come out of this, right? On your question about when, ito yung mas tricky na question because it depends on the success of these vaccines passing through the different stages of clinical trials, right? So at the moment, there most of the vaccines in clinical trials are in phase 1. A few are in phase 2, and uh, seems okay at the moment. Pero really, ang importante is for us to see the results of the phase 3 trials. Kasi there we will really see the safety and efficacy of the vaccine. And I don't think a vaccine will be ready this year. Possibly next year, early next year. But when I say ready, it doesn't mean that it's going to be available for everyone because it will need to be reviewed by the regulatory authority, like the FDA, for example, and then they would need to scale up manufacturing. And there are around 7 billion people in the planet at the moment or more. And so if you want to vaccinate everyone, that's 7 billion doses. And of course, realistically, that cannot be done by any company or even a few companies. So the target of the WHO for their ACT accelerator is access to COVID tools accelerator that they have at the moment is to provide at least 2 billion doses by the end of 2021.
Yeah. So actually, I have a follow-up question there. In terms of, can you educate us on the phases of the three
Yes.
phases of the clinical trials? Because these are the hurdles, right? For an effective and safe vaccine that
Yes.
we should get. Because there are anti-vax there, and of course,
Yes.
we want to address that issue also.
So for clinical development, of course, phase 1, 2, 3, right? You say clinical, that's when you give the vaccine candidate to humans. Preclinical, yun yung study sa animals. So phase 1 clinical is called the first in man studies. It refers to administration of the vaccine candidate to humans. And the primary objective of the phase 1 study is to look at the safety and reactogenicity of the vaccine, basically.
Right.
And normally you give it to maybe 20, 30, 40 people just to look at that aspect. Phase 2 is when you give the vaccine candidate to more people. And in the phase 2, you look at the safety as well. You look at the optimal dose, kung ano bang dapat ibigay. You look at the optimal preparation as well and the schedule of your proposed vaccine candidate. And if you see that the vaccine is okay, then you can proceed to the phase 3, where you give it to even more people. And actually, for vaccine trials, sir, you give it to thousands of people, unlike sa drug trials that you can give it to a few hundreds and it's okay na. Pero sa vaccine, you normally give it to tens of thousands of people. And this is because we want to see the rare adverse events. Kasi ang drugs, diba, you give it to people normally who have ailments or disease, and
Correct.
vaccines are generally preventive. So you give it to generally healthy people,
Right.
and you give it to more people, basically. So that's why we need to give it to more people in the phase 3 studies para makita yung rare adverse events. Kasi Usually the rare adverse events will show up 1 in 20,000, for example. So that's why you need more people in the phase 3 clinical trials. And after this phase 3, then you can submit your vaccine candidate to a regulatory authority to review and hopefully get an approval.
How do
Mel,
we
do we already,
how do we
sorry,
fast track the sorry, you're saying, Ma'am Carsi?
no, I was just curious if we already have like, is there a country or a company who's winning the race towards, the vaccine
Yeah.
production competition, if there is?
Yeah. Maybe Doc Melvin
Well,
will answer that
a
or Sir
few
Robert.
days ago, I think CanSino Biologicals, it's a company in China. They announced that their vaccine candidate has been approved for military use only. So it was approved by their regulatory agency to be approved sa military lang.
I
So
see.
technically it's approved, right? But
Uh,
only for military use.
okay. I'm interested in how the Philippines can contribute to this vaccine development, not only as a testing ground, if you may, for the vaccines that will be developed. So what do you think we can contribute in this vaccine development?
So you're right, sir. Madaming vaccines na may clinical trial sites sa Philippines.
Uh,
And I think we've shown that we have the human resources, basically, right? The scientists and the physicians to be able to conduct those clinical trials in our country.
I see.
Wala tayong vaccine manufacturing capacity locally. So
Uh,
I think that's the downside. A lot of the countries in the ASEAN region actually have local vaccine manufacturing capacity. Indonesia, for example, Thailand, Malaysia, Singapore. And when I say local manufacturing capacity is yung gumagawa po ng vaccines to be used in their country, like yung mga
uh,
pediatric vaccines, di ba? So for
uh,
us, all of our vaccines are basically imported.
I see.
I
I
think
see.
to add on that, Sir
Yes,
Lito,
Ma'am Carson.
Melvin, and Sir Robert, I think if we're gonna think, are we capable? Filipinos are capable. Yes, of course, we have the brains and even the beauty, to do that. But it's just sad that we are not really supported with this one. And I think we don't have the resource for this. We don't even have, the company for this or the office to, for these intelligent scientists to come together and think of, innovations or vaccines or whatnot. We don't have that capability because we are not backed up by it. So that's just the sad part. But if you're gonna ask if you're capable of it and how, or ang daming plans, ang daming pwedeng possibilities, pero hindi ma-execute because we don't have the resources. Yun lang. Ang sad.
Dagdag ko lang po para sa lahat po, meron po tayong apat na A na i-consider po usually sa kahit ano pong distribution ng isang healthcare resource. Ito po yung is it available, accessible, affordable, and acceptable. Available, it's still up to the companies to who's the first to actually make it available. And if it's available, who would have the first access to it? We're already having some issues with, for example, recently there's a news about remdesivir, wherein
Mm.
the US actually bought the supply for
For
remdesivir
the
for
next
up
three
to
months.
September.
Yeah.
So there's a possibility that first world countries would actually have access to it. And just in case that it will be accessible for all countries, will it be affordable? Will the government be able to procure the amount needed for the Philippines? It's just like 100 million people. So will we have funds to actually support that, or will this be a public-private partnership? And eventually, will it be acceptable? People would need to weigh in the quality over the speed of development. There will be people that will actually be skeptic about this vaccine, especially at the rate that it is produced. So this would be a major challenge in terms of achieving vaccine immunity. And at least in the US, they're preparing to have the vaccine for 2021. I think that's the optimistic estimate that they have, but it still depends on whether those vaccines will be produced, and will people actually be willing to vaccinate themselves with such a vaccine.
We can't hear you, sir.
Yeah, thank you for that. What do you think is the best program to deploy this vaccines when it becomes available to the public? Who should
So,
first
uh,
get it?
w- okay. So there are three schools of thought for that, sir. So yung isa sinasabi is you give it first to the healthcare workers kasi sila yung frontliners, di ba? The other one is you give it to those who really need it. So yung mga um, people over 60 and people with chronic medical conditions, because you really want to maximize the protection of the vaccine.
Mm-hmm.
Um, there are also people saying that it's ethical to give them to those who volunteered sa clinical trials, di ba? Kasi
Right.
they volunteered their bodies to be used as subjects in the clinical trials.
Mm-hmm.
But it really depends on the number of doses that we have,
Mm-hmm.
um, and also depends on what is really the situation in your particular country. Kasi, for example, let's say in your country, you see that only the over 60 years and above are dying from COVID, then you'd have to prioritize them. So also these things have to be weighed, di ba? Kasi it's ethical public health issues have to all be considered before you really make a decision in these things.
I see. I see. Because I was thinking that a lot of Filipinos won't be able to afford it, right? And so when it becomes available, these sick and dying, unfortunate, less fortunate Filipinos, how will they afford such vaccine? Diba? What would be the estimate cost of a dose of this vaccine?
So there's this organization called Gavi. It's
Mm,
Gavi, the Vaccine Alliance. So they've been
uh-huh.
helping low and middle income countries to
I see.
purchase vaccines.
I see.
For example, the HPV vaccine. What else? Pneumococcal vaccine. So they're buying these vaccines from the companies in bulk para pwede
Mm-hmm.
silang basically mag-negotiate to lower the prices, diba?
Uh-huh.
And they're also involved now to make sure that when the COVID vaccine or COVID vaccines become available, they can help with this aspect. Pero again, implementation is a different issue.
Okay, so being this would be my last question on vaccine, I guess, but you can still say something about it. I think I'm interested on how or what's your opinion on the best strategies for this vaccine? Should it be mRNA based because it's faster to produce, or should it be the killed inactivated one?
Well, it's always a balance between how fast you can produce the vaccines
Right?
and how effective they're going to be,
Uh,
right? Kasi if you look at the different modalities of vaccines, like you said, ang mRNA can be made really fast.
mm-hmm,
But the reality is we don't have any mRNA vaccine at the moment approved for human beings or even for animals.
mm-hmm, mm-hmm.
So
I
the
see.
technology is there. It's well studied, but it hasn't really basically proven itself, right? Kasi
Uh,
wala pa talagang approved.
uh,
We have the inactivated live attenuated vaccines na we know are more basically um they can offer long-term protection, for example, or higher efficacy. Pero it's more difficult to create those vaccines. And there's a higher risk of, for example, the live attenuated vaccine. There's also a risk for them if you give them to people with a weak immune system, that they can be infected with that specific disease that you're trying to prevent. So it's I think we can only answer that once we've seen the efficacy results of these mRNA vaccines.
I see. I see. So thank you, Doc Melvin, for that answer. No? So now let's move on to Ma'am Carcy Viola. Um, how was the COVID-19 change the healthcare system, Ma'am Carcy, both in the Philippines and in the world or in Europe, for that matter?
I think in my honest opinion, parang in a way it improved the
Ah,
healthcare
I see.
industry in terms of practice, especially sa ating mga nurses and doctors. First siguro in like here in Europe, since I work here po, hygiene is always number one. And I think when nung dumating po ako dito, I was really shocked by how hygiene is super parang um nahihirapan ako mag-English kasi minsan naisip ko yung German word. So inisip na ine-emphasize,
Go
sorry.
ahead.
So how they how they emphasize the hygiene practice.
Uh-huh.
So before we even work, there are even hygiene nurses, hygiene professors and mentors for us to be able, for the nurses and doctors to be reminded that hey, do this and do that. And
Mm-hmm.
we always have these five indications or
Uh-huh.
five hygiene practices, like before we go inside the patient's room, before we even touch the things of the patient, before we
Uh-huh.
touch the patient, after that,
Uh-huh.
and so
Uh-huh.
whatnot. So, um, hand disinfection is super number one practice there. And although in Europe, they're not really used to wearing masks.
Mm-hmm.
Um, at first, they were actually surprised by us Asians using masks at the first months of the COVID
Uh-huh.
pandemic. I think January, I was already afraid and I was wearing mask already. And they were
I see.
asking me, why are you wearing that? That's not effective. So I was trying to explain myself because in
Uh-huh.
relation to the Philippines, we always use that because
Mm-hmm.
I think in the Philippines, the diseases are also different. Like sa atin, medyo rampant ang tuberculosis. Since I worked in a public hospital, for us, number one is hand washing. But since because of the, our situation, especially in the public hospitals, limited resources, limited alcohol, limited everything, the hygiene part of our practice as nurses and doctors are being left out, which is
Uh-huh.
very sad because yun nga siguro when I came to Germany, I was surprised and I even forgot to do these important stuff. But because of COVID, I think that really helped and reminded us nurses and doctors this number one key. Do you know, tulad nga ni Florence Nightingale, ang number one niya dyan is talagang hygiene to prevent
Uh-huh.
the contamination between patient to patient. And tayo yung key doon. We have to like practice more. Like ngayon, in the Philippines, I see nasobrahan ata sa pagiging hygienic ng ating mga, even the Filipino citizens, they use the alcohol every time.
Uh-huh.
The nurses there use, protective measurements. And I think dahil sa takot yon. So I
I
think in a
see.
positive way, it helped the healthcare industry. In a way lang po na sa practice. But in terms of fighting the disease, it saddened me because of course we lost our fellow healthcare practitioners to
I
this
see.
fight.
So with the follow-up questions, with the limited PPE for frontliners, what's
Mm.
your suggestion on this? How can they be safe in terms of the limited? Even sometimes they recycle it or they reuse their
Yeah,
masks. So what can you suggest?
for the shortage of the protective equipments that we have, I think I would like to base it on the practice here. I don't
Mm-hmm.
want to be because you work in abroad, that's why you have that
Mm-hmm.
thinking,
Mm-hmm.
because it's effective somehow here. I think first we have to at least somehow lessen the face-to-face encounters with patients, especially with COVID patients. If we are working in a parang telemetry, let's maximize the telemedicine. Like we do
Mm-hmm.
really do not have to go to the patient's room and interact with them personally. We can use our telephones, our
Mm-hmm.
speakers, and all that. And of
Mm-hmm.
course, for the other protective equipments, like let's say the mask, I know we've exhausted our resources from this, and we even get from China. Just to add on this, all our masks, disposable masks, are from China, and all the brands are from China. So or a hospital have come up with, reusable masks. And I think that's effective somehow because um, it helps the shortage of the, the materials for protection. And kahit papaano, I'm not sure, Doc Melvin, if you can back me up on this, because the reusable cloth mask, which are, doubled somehow,
Mhm.
can already stop, stop the spread of the droplet. So we use that at work, and it is always washed with 60 degrees, like they wash at 60 degrees. And I was asking, effective ba to? Kasi usually pag Filipino, very pessimistic eh. Kailangan
Mm-hmm.
disposable. Ganyan.
Mm-hmm.
But they explained to me that it's effective and it's okay to do that as long as
Yes,
it's,
yeah, you're right. I think the WHO released guidance on this 2 weeks ago. So
Mm-hmm.
they made a study actually it showed that if you make these face cloths with 3 layers, and they have specific layers in this guidance, that these are as effective as, for example, a surgical mask, for example, and you can wash these masks. So my guidance po yung WHO about this.
yes. And to add on to that po siguro, because I've noticed from the hospital in the Philippines, especially the public hospital, I think to be able to manage this shortage sa ating resource materials, if you're not working in a COVID station, you really don't have to wear all these, these equipments na papawisan ka lang and it will just harm your body. And I think there are hospitals in the Philippines that do this na minsan, I think, just for me, unnecessary. We already know, we've learned from this one, from other countries, that we just need to use the proper protection and hygiene and self-care, and we don't need to wear all this stuff even if we just work in a non-COVID station. So yun, maximize yung siguro yung mga unnecessary things na kailangan natin gawin, wag na natin gawin.
I have a question for Mom Carsi also again and Sir Robert. Are you aware of the statistics of death of the nurses and doctors in the front lines, no? That's associated with COVID-19, and compared with let's say Philippines with UK or Germany or US, what are the major causes of deaths aside, of course, being infected? No, what are the real issues or why these health workers die, knowing that they should be or even wearing those PPEs and being safe in everything that they've done, yet they suffer the virus. So what happened? Bakit sila namatay?
Sir Robert, like, I
Sige.
cannot
Ako
really
muna, sige.
answer that here
Sige,
because in
sir.
Germany there are not really so many who died.
Right.
But ang dami rin pong na-infect, but just symptomatic, and they managed it symptomatic, and because the country has been able to manage it early as ang aga nilang na nagawa ng paraan, so hindi umabot sa talagang tumaas yung death rates ng mga practitioners.
At least the experience dito sa US, there have been criticisms that the government wasn't able to provide PPEs
Mm.
for the staff. And most of the deaths occurred within those first few months because of the lack of PPEs. Eventually, they were able to, the hospitals were able to prep up their supplies. So there was some government critiques about the supply of PPEs. And I think in the Philippines, I think the problem also in the Philippines is the supply of PPEs, to the point that volunteers need to step up in terms of, for example, fashion designers crafting PPEs,
Mm-hmm.
the protective suits for
Mm-hmm.
healthcare workers. But even before the pandemic, there's always a high risk for healthcare professionals to work in our healthcare system because of the um, high healthcare worker to low healthcare worker to patient ratio. So sorry, we have so many patients to take care for each healthcare personnel. So
Uh-huh.
imagine that you're a nurse, then you need to take care of like at least like 20 patients,
Mm-hmm. Mm-hmm.
and they might be from moderate to severe, and to some extent it would actually, I mean, decrease your immune system because of overwork and fatigue.
Mm-hmm. Mm-hmm.
So that is one, I would say, at least that's my hunch in terms of the system that we have in the Philippines, is that it's already been an issue for decades that we don't have an ideal, um, at least healthcare worker to patient ratio. And unless we can solve that, it will be inevitable that many more will die if, and you couple it with reduced supply of PPE.
Yeah,
I
so
see.
I agree with both of you. PPE is a one big issue, tsaka overwork, like what Robert said. And
Mm-hmm.
also, I think if you look at the deaths of medical or healthcare practitioners, a lot of these deaths happened in the earlier stage of the pandemic na hindi pa natin masyadong gamay ang COVID. So
Mm-hmm.
now it's not as big as a problem compared to before. Kasi the past 6 months we've learned a lot about the virus. We've learned a lot how to basically protect ourselves from infection and also to manage. And
Mm-hmm.
we've had successes na,
Mm-hmm.
small but still success in terms of kunyari antiviral drugs that we've s-
Mm-hmm.
um, seen that work in lowering the viral load or reducing the number of hospital stays, like
Mm-hmm.
remdesivir that you mentioned, right?
Mm-hmm.
And also dexamethasone from the recent recovery trials in the UK, which showed
Mm-hmm.
that using dexamethasone in patients with a severe COVID, for example, reduce their risk of death by 30%. So we've improved in terms of our understanding of the virus. And kumbaga, in the earlier days of COVID, talagang we were helpless, and we are not as helpless as that stage of the pandemic.
Doc, may I ask you about home remedies that came out? A question from the audience was given, and was interested with the home remedies like steam inhalation.
Mhm.
Steam inhalation.
Yeah.
So, what's your opinion on that? Does it really work?
Well, if you talk about the symptoms, it can help relieve the symptoms,
Uh
'di
huh.
ba? So, kunyari, you have stuffy nose or sore throat or things like that, it can help.
Yeah.
Pero it doesn't mean that it will kill the virus or will treat your disease. So
Uh-huh.
those are two different things.
Yes. Yeah.
Uh, I think we should not confuse those two because it can help with the symptoms, true,
Yeah.
but it does not treat the disease or kill the virus.
Yeah. I
Yeah,
think it's
I think
associated with mucosa, right? So if the mucosa, the lining is dry,
Mm.
it's more prone to infection, right?
Yeah, yeah.
But
So
when it's
yeah,
wet,
yeah, that's right.
yeah, and
That's right.
moist, yeah, the cells are much better in protecting the body, against
Mhm.
COVID, against SARS-CoV-2.
So I
I
think
think
it's also not good for us to dismiss because
Right.
it helps with the symptoms.
Uh,
Just be clear in telling the patients that this is helping with the symptoms and not treating you for
Yeah.
COVID.
yeah. Sir Robert is saying something.
ayun, naging point of contention yan recently
Uh-huh.
sa ating national news, which is yung tuob sa Cebu.
Uh-huh.
Yes.
So that's why there's the importance of risk communication sa health
Uh-huh.
communication.
Uh-huh.
During this pandemic, politicians would be the important source of health communication. And if
Mm.
there is some conflict in terms of communication, the
Mm.
way that steam and inhalation was communicated was that it's almost like a way to prevent the disease.
I see. I have a question. What really happened to the hydrochloroquine, if you may? Anybody can answer. Because I think there was a conference between Singapore, Philippines, Taiwan, and I think Japan, and they saw some positive response of the patients using hydrochloroquine at that time in, I think, in March or April. And
Actually,
now, yeah. So what's your take on that?
just experience based because here in Germany, during the peak of the COVID, most of my friends who worked in the COVID station told me that they used this medicine along with um HIV drugs as well. So far at that time, around March, April, during the peak, it was really used, but not really as official medicine, but also there were on a testing phase. But right now,
Mm-hmm.
since we do not have COVID stations open,
Mm-hmm.
um, I'm not yet sure if they will continue using that or they will discontinue or what.
As a nurse in Germany, Miss Carcy, you're aware of these therapeutics that are dispensed, right, to the patients. So, what
Actually,
are the what's this? What are the best practice, or what are the top therapeutics that you saw or that you're seeing being dispensed to these patients?
what's good about here is that they are really transparent and they have reports always on our intranet on what are, given to patients or what are used.
Mm-hmm.
And from the latest ones, we most of the patients are being treated symptomatically. So yung symptoms lang po talaga yung inaasikaso. Like for example, it was really popular here to take vitamin D3,
Mm-hmm.
because it
B3.
helps, especially for older people.
Uh-huh.
Um, it boosts their immune system po. And
Mm-hmm.
then what's used as well is, of course, yung mga therapeutic, kunyari po, they're having difficulty breathing, of course, hindi po sobrang oxygen, vitamins, and what else? I have a friend who was a COVID patient, and isa lang po talaga yung binigay sa kanya, vitamin D, and lots of water. And if you have fever, paracetamol, if you have, you just have to drink water. And they really do not have exact medicines for this because they're just fighting the symptoms. And
Yeah.
I don't know, miraculously, it's really effective eh. Ang
Yeah.
taas ng recovery, Tito Doc.
Let's hear
Ay,
it
sir,
from. Yeah, thank you, Ms. Carcy, for that. So vitamins are really useful also. No? So let's
yes.
hear from Doc Melvin as a physician. No? Um, so what's your advice, no, to the Filipino doctors right now who are treating this COVID-19 patients?
So I think it's important to look at the guidance that the WHO is sharing kasi yung WHO po, they coordinate with all the different countries in
Mm-hmm.
the world and looking at the best practices, and
Mm-hmm.
they're doing this, I think, weekly. So
Mm-hmm.
if there are new best practices in specific countries that can be shared, they usually update their guidance. And it's important to look at these guidances kasi ito po yung kumbaga is a combination of a summary of what the other countries that are controlling this pandemic, what they're doing. And so I think that's one thing. And also to actually really look at see the patients early before
Mm-hmm.
the condition worsens, kasi if they're seen early and you manage them early, there is a lower chance for them to deteriorate. So I think this is one thing that's really important in managing the
Until
patients.
until the vaccine comes out, right?
I think
um
to say on that. I think that's a challenge for the Philippines, especially for the middle class, especially the lower class who do not have transportation to the hospitals, especially when, older people who just live alone. And yun yung naging problem po kasi we do not have, I'm not sure if we have hotlines in the Philippines if someone's feeling sick and if they could call the DOH or what. I think that's the problem because, for example, my mom had symptoms and like sore throat and all that and fever. And at home, we do not have a car. So, and my brother who lives in Marikina has the car with my dad. So we had problems because they were not allowed to go to QC at that time. So
Mm-hmm.
we had no Grab cars or
Mm-hmm.
Uber or so, and we just actually lived near a public hospital. But then
Mm-hmm.
we were afraid because the hospital is already crowded as well, so it will be
Mm-hmm.
difficult for my mom to, and it will take a long time to wait for that. And we
Mm-hmm.
have to think, okay, maybe we can go to a private hospital
Mm-hmm.
which provides faster tests, but
Mm-hmm.
it's expensive. Like we had to pay 6,000. I'm not so sure, but thousand, more than 5,000 for that test.
Mm-hmm.
For that test. But it's really sad because ang effort po talagang maging okay sa yung pangangatawan natin. Like here po, if you feel something, you call the Ministry of Health or go to your doctor, you get the test for free.
Yeah.
So I
Yeah.
think yung early management and knowing if you're positive or not at that early time is really helpful. And like sa atin sa Philippines, we're afraid to go out. We just say, okay, I'll just stay in the house, maybe I'll get better. So yun po yung
Mm.
challenge. And if we imagine what more for the poor people who do not have access to these.
Yes, yes. Okay, let's now switch to Sir Robert, no? In terms of information or disinformation on COVID-19. So, what do you think of these disinformation? How are we going to avoid this? And what are your advice to the public in terms of you know which ones or how to discern these kinds of information that might come out even um, in the public, in the media.
Ayan. So meron tayong three terms na gusto kong i-share sa mga
Thank you.
tao. Meron po tayo nung salitang infodemic,
Uh-huh.
health misinformation, at disinformation.
Uh-huh.
Yung DIS.
Uh-huh.
Magsimula muna po tayo sa infodemic. Ang ibig sabihin po ng infodemic is like an epidemic, it's a sudden surge of information related to a health concern.
Mm-hmm.
And most of the time, that information is often false. The problem is that because of the sudden surge of information, natatabunan yung tamang information.
Mm-hmm.
So the United Nations actually called that the battle with COVID-19 is not only with the virus in itself, but with the infodemic that what's happening.
Mm-hmm.
And what we're concerned about the infodemic is the larger proportion of health misinformation.
Mm-hmm.
Yung health misinformation, ang ibig sabihin po nun ay mga bali-balita or information na wala pong scientificong basihan. There's no
Mm-hmm.
scientific basis and it's not
Mm-hmm.
true. Ano naman po yung disinformation? Yung pinagkaiba ng misinformation sa disinformation is that yung misinformation, hindi natin alam kung sinasadya ba itong ikalat ng ibang tao for political advantage or not.
Mm-hmm.
Mostly yung disinformation, it's about yung sa political disinformation. So, ang focus mostly sa atin is yung sa health misinformation. So, maraming iba't ibang uri ng health misinformation. Pero ang isa sa mga unang dapat nating gawin is that when we actually see news, mostly yung health misinformation kumakalat siya within our close contacts. It's common for most Filipinos to be social media users. And within that public social media, there is what we call the closed social media, which is yung mga group chat. Within the group chat, makakita tayo minsan may mga kamag-anak na gusto nilang mag-share ng something na balita. They don't actually mean na mag-share ng false news o ng health misinformation, pero tingin kasi nila baka makatulong to sa'yo. So,
Uh-huh.
ang advice ko lang sa ating public is that we hope that we will be more discerning sa information, and it's actually good to pause and stop and reflect whether sharing this information, where sharing the information, the health information will actually bring good to people. So we
Mm-hmm.
can actually ask friends, relatives, whether or not discuss with them kung totoo ba to, hindi. And it's really
Mm-hmm.
important for now to actually pause and
Mm-hmm.
think critically before i-share. Kasi tatandaan natin, pag tayo nag-share ng health misinformation sa social media, it only takes a screenshot and people might criticize that.
Mm-hmm. I
And we
see.
need to have the responsibility to be able to stand up with whatever we're sharing. That's why mahalaga po if you get if you receive health misinformation posts on the social media, you don't share it so that you stop the transmission. So it's about cutting the chain of transmission of not only the virus but also of the misinformation.
Yeah. So it's also good to be aware of the the websites, know where they're coming from, right? Because
Mm.
sometimes if these are from the streets, right, and you spread it
So
easily, That would be a question right there.
May tatlong level tayo na pwedeng pagkuhanan ng information. Una is yung sa global, which is yung World Health Organization. They have the COVID-19 Mythbusters, which shows the different myths about COVID-19 and what's the best way to counter that. So nagbibigay sila sa mga fact. Eventually, we have your DOH Viber account, Viber group, wherein you can actually get daily feeds about
Mm-hmm.
COVID-19 and also news. And makakatulong din if our viewers are subscribed to the Facebook pages of their local government units. So, kunwari sa amin, sa Mandaluyong, pa sa probinsya namin sa Alaminos, Pangasinan, may
Mm-hmm.
mga, yung LGU, meron sila ng Facebook page and they actually post updates. Siyempre,
Uh-huh.
kung most likely naman nagpo-post sila ng tamang information, pero it would actually help if we spot some news that are inconsistent. We can actually post comments to rebut or to actually argue with that information na sabihin natin na ay medyo hindi po yata to accurate, baka pwede nyo po i-double check.
I see. I see. Okay. I'm quite interested with because it's your field, no? Health communications. I'm quite interested with some of the apps that are available on cell phones, no? So how effective are they in terms of warning our people from someone who is probably asymptomatic or symptomatic in the area? Does it
Siguro
really help?
there are several apps that have been developed privately. So it's not something that is developed by the government. There's no government endorsed tracing app. For example, may example natin, not necessarily app siya, pero meron tayong
Mm-hmm.
staysafe.ph. Meron din yung ginagamit sa Cebu, which is yung WeTrace. Then meron din yung EndCOV, which is made by the Asian Institute of Management students. Then meron tayong COVCD at meron pa yung medyo catchy yung term niya, TANODS COVID.
Okay.
So, I think the problem there is hindi siya as unified
Uh-huh.
as like, for example, sa Singapore na yung meron sila nung Trace Together or sa New Zealand na New Zealand COVID Tracer app.
Uh-huh.
The problem with fragmented apps is that you don't have the critical mass of users for it to be effective for contact tracing.
I see. I see. I
Agree.
see.
So
And
that's
and if it's
a
not
limitation.
harmonized, then how can you actually look at the data and
Yeah.
compare, right? So here in Switzerland, we also have a similar app, pero this one was made by the government, and
Mm-hmm.
it's not compulsory, pero a lot of people have it on their phones,
Mm.
and
Mm-hmm.
because it's only one app,
Mm-hmm.
it's easier for the government to actually make sense of the information.
I see.
Yeah,
So
here
you
is
think
we're using it too. I actually have it in my phone,
uh-huh.
and
What is
it's
it?
it's Corona Warn app, and
Okay.
and we have to always turn on the Bluetooth. So here, medyo
Uh-huh.
feasible country since everyone is using their cell phones. But I think
Uh-huh.
Philippines, even though we have this app, it won't be really possible, especially for those sa mga walang cellphone. They won't be.
Uh-huh.
It's gonna be.
I see. I see. Okay. So I think our time is almost up, but I'd like to give everybody a chance to close. By the way, uh, I'd like you to encourage our students who might be taking BS Biology and other allied health courses. So maybe you can say something about that as we close.
All right.
Sir, Ma'am Karen.
Okay. For those taking biology or any pre-med course, I think right now you are afraid or kind of you have that feeling na should I continue or should I still be in this place? Is this for me? You have to keep the fire burning. You have to remind
I see.
yourself why in the first place you took this course and why in
Uh-huh.
the first you want to take this course for the next year.
Uh-huh.
This is actually a challenge for us, and this is quite a very big step for the healthcare industry and for us new doctors and nurses na hey, this is possible pala mangyari sa mundo. Now we just
Mm-hmm.
think na we just see in the movies or
Mm-hmm.
it just happened in the past, but it's possible. And for us, what we can be innovators, and
Mm-hmm.
this will just keep the fire burning and
Mm-hmm.
not be afraid because this is the time where the Filipino people really needs to.
I see. Doc Melvin, thank you.
Well, I think actually science development in the age of COVID is extraordinary. We've never
Uh-huh.
been in this situation that thousands of scientists are working on a particular pathogen alone, right?
Uh-huh. Uh-huh.
Even for HIV, this has never happened. So actually, I think it's a very interesting time for science, medicine, and healthcare professionals. We've shown the world that we actually are useful. We are needed in
Yes.
this world. So I think it's it's another way of looking at this pandemic. It's highlighting our value in this
Uh-huh.
planet.
Uh-huh. Uh-huh. You're the new heroes actually right now as frontliners, right?
Yeah, so yeah, it's basically changing um,
Yes.
the way people are looking at science and medicine.
Yes, yes. And it's the best time to take BS biology, right?
Yes, it is.
At this time, especially at Trinity. What about Sir Robert?
Ayun. So, katulad nga sabi ni Sir Melvin, science, we need to do science to actually combat real-world problems.
Uh-huh.
So, for instance, you're a senior high school student, you're planning to do bio, more likely, pag nag-graduate school ka, topic pa din ng COVID. Even up to
Uh-huh.
now, SARS is still being discussed and being researched because there's so much unknown with SARS. Like, for example, bakit siya biglang nawala?
Uh-huh.
Then suddenly there was a reemergence of COVID. So I would say that COVID as a research topic, at least in biomedical science, would
Uh-huh.
actually span for more than 2 decades. And there's still some possibility that there will be some reemergence in the future. So we actually need the new generation of health researchers and healthcare workers who would study COVID-19,
Uh-huh.
manage COVID-19, and would actually prevent a pandemic like COVID-19 from happening again. So sa
Uh-huh.
mga estudyante, lalo na sa mga current students ngayon, if you're in the health sciences, you may think that what you're learning is highly theoretical, but there will be a time that what you're learning might even help mankind. Just think of vaccine development.
I see. I see.
Yeah,
So,
and I think it's not a matter of if it will happen again. It
It
will
will
uh-huh.
happen.
maybe hindi siya coronavirus, maybe flu. 'Di ba?
Uh-huh.
Kasi
Uh-huh.
people were expecting to have a flu pandemic, but it didn't happen.
Uh-huh.
And this is the first coronavirus pandemic. So uh, we will always be needed by the world. So maybe every 15 or 20 years,
Uh-huh.
may mangyayaring something na ganito. And
Yeah.
it highlights the value of our field.
Uh-huh. Uh-huh. So, let me just wrap it up. Actually, so thank you so much for your time. We really appreciate it, and I hope that our listeners and our participants got something from today's topic. No, so that's the real score, everybody. No, and the vaccine is in the pipeline, right? And
Yes.
they should be coming out soon. And we are hopeful that our government
Don't say
will.
soon, sir. Baka hindi soon. They're coming.
Okay, they're coming.
Don't know when.
And yes, and then there are already promising therapeutics for this, right, Ma'am Karen?
Yep.
Yes, that and even the home remedies, as you said, the scientific basis of these can be seen as well, right? Such as the making your mucosa moist, no, as you do steam inhalation, and of course we also heard from Sir Robert when he talked about the proper discernment of this information that comes out in the media, right? And we should be able to get it from the right source, from the WHO, from the CDC, from our DOH in the Philippines, right? And when we sense that it might not be it might be a fake news or questionable information, then we stop spreading it, right? So I think it's for the public. We owe the public that kind of attitude towards these kinds of information that we get from the social media, right? There are so many questions thrown in the audience actually in the chat box also, but these will be answered by you. I hope we can send some of these questions to you, and they can be answered in the CASE interface, right? Because of the time constraints, we cannot answer all of these very interesting questions as well. No, so let's say there was a concern about the ecological impact of using so much disposable PPEs like that. So you can address those concerns from the public, actually. So with that, I want to thank you so much, really, and appreciate your time. And let's hope that all these vaccines will come out, will be developed, and will be deployed. And this flattening of the curve will happen sooner than later, and that we can go back to normal soon. Okay. So thank you very much, everybody, and have a good day. Have a good day. Thank you.
Thank
Thank
you.
you.
Thank you.